80% of the cases in South Carolina are African American women. The number one risk group for transmission in black women is heterosexual sex. Plus, the lack of awareness of risk. I'm a heterosexual woman, I'm having sex with a man, HIV is a gay disease, it's not my problem. Well, it is. Providers talking to their patients about HIV, sex and sexuality is also, I think, contributing to that. But it's a subject matter that makes providers uncomfortable, let's face it. Providers also stigmatize. And so what I try to say is, you should not, but here's how you do it safely, is wear condoms and they're free, come and pick them up. But what happens to the patients who can't see a doctor? Those are the people I worry about. We know from our surveillance data in South Carolina that 40% of the patients who are HIV infected, we have no idea where they are. Yes, they might be receiving care out of state, but I find it very hard to think 40% of very poor people are driving back and forth to some other state to go get care. Some things have gotten better. We certainly have more people on medicines. The medicines work quite well. We've also realigned our prevention activities with the National HIV/AIDS strategy. So in a few years, we expect to see some improvements. So it's not all doom and gloom. It's just how to scale up to allow access to more people, so that more people are benefiting. Call it naive. I just don't think that anyone who's sick with any disease in the great United States of America should go without care. The AIDS Drug Assistance Program provides HIV care to people living with HIV/AIDS who can't afford or do not have, or even if they have insurance, can't afford the co-payments. And so we've had access issues where the number of people who are HIV infected versus the number of money in ADAP don't match. People are living longer with HIV, which is a great thing, but funding hasn't increased to meet up with that.
Okay, breathe.
I think issues of transportation, stigma, the church, for good or for worse, all of those things converging at a bad time accentuates what your weaknesses are. But we depend on the federal government and the state government to appropriate the necessary funding. So that's been one of the most difficult things being in this job.